All right, this will be interesting. We're integrating the virtual world and the real world. So hello in 3 dimensions, everyone. I'm Shawna, as you know, from 2D. Very nice to all meet you. If you wouldn't mind just kind of telling me your first names, because I don't have the luxury of the Zoom tag right now. So we'll start at this end. Imre. Okay, perfect. Samadhi. Tasmin. Talani. Jerry, Talani, Tasmin, Samadhi, Imre. Okay, I will be asking you those again. I apologize in advance. So I'm going to slip on the headset. If for some reason I'm too immersed in the virtual world, just get my attention. Today, we're going to be talking about immersive technologies and how that integrates into medicine. As disclosure, I work with an immersive medicine company, Luxonic. So this may be a bit Luxonic heavy. I did try to offer some balance, but by virtue of my job, there's going to be a lot of focus on what we do as well. All right. And hello to everyone tuning in virtually. Hopefully you will get as much out of the presentation as you do out of the, probably more so out of the presentation than you do from the interactive component, but hopefully you get something out of this. Okay, so introductions, we've done that before. As you know, I wear a lot of hats, and as I just said, we'll be focusing on the hat I wear as VP of Immersive Technology of Immersive Medicine with Luxonic Technologies. And so let's kind of take a step back and work with some definitions. First of all, what do we mean when we say immersive? So immersive really refers to any type of technology that kind of brings us in, as the name suggests. And one could argue that the first ever immersive technology was a book. And so if you think back to before we had headsets, before we had phones, before we had virtual reality, the best way to lose yourself in a new world was simply reading a really good book, whether it was Tolkien or, you know, other fiction from your childhood. And so the definition we use for immersive technologies is creating that perception of being physically present in a digital world. So let's get a little bit more concrete. What examples of that do we refer to? What do we mean when we use the term immersive technology, XR, extended reality, MR, mixed reality? So part of that is augmented reality. So that means using a digital overlay to help yourself navigate through the real world. We also talk about virtual reality. As you can see, we brought some Oculus headsets with us to hopefully have time at the end to play around with some immersive technology. So that means putting yourself into a virtual world or a digital world and interacting with that. Mixed reality, having both. So interacting with the virtual world as well as having real world interactions, and 360 video. And so that's putting yourself in video in 360. You may have seen that through your headsets on Facebook already when someone puts a 360 video and you can turn your phone around and interact with the 3D world. Are you hearing me okay with the mask on? Okay, perfect. Yeah. Okay, so this is technology in the future of medicine. So let's talk about immersive technology and medical education. So why is this relevant? Well, we're seeing even in clinical medicine that augmented reality, immersive technologies are playing more and more of a role in everyday clinical practice. And so, for example, here's a screenshot from a virtual Grand Rounds 2019. I want to say this is University of Manitoba, but I couldn't confirm this when I tried to look earlier today. But the Grand Rounds presentation was on augmented and virtual reality in medical education. What I was saying is that we're already bringing immersive technologies into medical practice. So for example, Cleveland Clinic has collaborated with Microsoft to bring that mixed reality technology for education, specifically in the case of anatomy. And so we say a picture is worth 1,000 words. So maybe having a video or a virtual reality representation is worth 1,000 words. And so we're also seeing this in surgical planning and surgical teaching. So here's a professor, I think he's out of the UK, and he brought immersive medicine into his lectures when teaching third-year students for medical school. And in fact, there's publications that are increasing around this. Their results are a bit mixed. So here's a study about using traditional PowerPoint for teaching anatomy versus using Microsoft HoloLens for teaching anatomy. And so they found that the recall was better with traditional PowerPoint. Now you have to ask yourself, why? Is that because that's a more familiar medium? Whereas the HoloLens made it more engaging and reduced anxiety. So there's pros and there's cons, but at least what we're seeing is the emergence of a new platform, and it's did not prove deleterious. So that's kind of, anytime we're talking about medicine, we talk about non-inferiority studies. This isn't necessarily a clinical trial, but it does show that there's potential for this medium to augment learning in certain respects. So slide 14. So I'm going to play this video. Feel free to follow along at home. So this is an example of how augmented reality is being used for anatomy with HoloLens.
The HoloLens is absolutely the most amazing.
I don't know
piece
that
of
you guys don't have the audio.
Within
Oh, you
5
do? Okay,
seconds,
perfect.
I realized that the world had changed. It was an immediate realization that this is something exciting and we have to be a part of this. Seeing things in 3D is something that you could do before with some glasses. The thing that the HoloLens gives you is the ability to walk around those 3D objects and to really experience them as if they're in the room with you.
It is augmented reality, it is mixed reality. And what that means is I still see you, I still see this room and everything around me, but the digital content is inserted into the room as if it's actually there.
As a teacher, I can see what they're all looking at. And that's something that we think has real power.
It's actually opening up our interactions with each other.
The biggest drive is getting the anatomy curriculum completely done by the time we move into the new health education campus.
So we won't go through the entire video, but you can see there's an example of mixed reality in practice and how it's being applied to medical education. And so here's a fun fact, actually. So some of you are medical students, right? No?
There's a
In the virtual.
medical student on Zoom, yeah.
So the University of Alberta actually has a director of extended reality for undergraduate medical education. So, you know, if you are really keen on bringing immersive medicine into your curriculum, there's an avenue for kind of advocating for that. So keep that in mind as we go through today's lecture. So that's kind of a broad overview of different applications. So for anatomy, for surgical planning, for using mixed reality. So let's talk a little bit about what I do with Luxonic. Before we get into that, here's some stats. So we talked about HoloLens findings, but in taking a step back and looking at immersive technology as a whole, there are some benefits. So there's faster training, greater learner confidence when applying that to the material, more emotional connection, better knowledge retention several months after the fact, more focused than e-learning, potentially because it's more immersive, and always the bottom line as well, so more cost effective as well. So the summary is, and if it also retires risk. So imagine the first time you ever practiced an IV or a line or a surgery was on a digital patient rather than a real patient. We talked about the improved learning outcomes and retention, and then the cost saved. So now for real, what do we do at Luxonic? So we apply immersive technology for medical education, professional training, and healthcare delivery. So I want to take you through 3 of our learning applications, and then at least 2 of these are loaded onto the headset. So hopefully you'll get to play around with them after. So this is Medcast 360. So earlier we started talking about the value of immersive and 360 video. So we've actually, we have a platform that focuses on secure medical content. So it's kind of like UpToDate and YouTube combined for learners. So some of the case studies that we've run. So we've partnered with Sask Poly and their nursing school to create a series of orientation videos for circulating nurses. So in 360 video, we have a gallbladder, a laparoscopic gallbladder removal from start to finish, and you're viewing it. So you're orientating, you're a nurse, and you're viewing it from the point of view of the circulating nurse. And actually, that's one of the videos that's loaded up on the headset, so you can experience that in 360 later. We've used it for ultrasound training. And then one of my favorite studies, which isn't mentioned here, we've actually used it to reduce sedation in pediatric populations. So kids and MRIs don't often go very well together. It's scary for them. Kids don't know how to stay still. So most of the time they require sedation to go through an MRI. In one of the studies we did, we orientated the pediatric patients to the MR environment in 360 using this headset, and we were actually able to reduce sedation by 87%. So there's also value for improving or reducing medical interventions as well in clinical practice. So Sievert, this is a radiology reading room and a headset. So the applications for this are both educational and diagnostic. And so this is something I'll take you through a video of in a couple of slides. But basically, the problem space in radiology today is that to have a good radiology setup is expensive. It takes up physical real estate, and you need high resolution monitors. So for those of you who are medical, who are either medical student or resident level, you know that if you need to have, or if you require the resolution necessary to actually have the ability to read an X-ray properly, read a CAT scan, those are high resolution monitors, and the average cost is about 30,000 US for that setup, not including administrative costs. And so what we've created is a virtual reality reading room in a headset, and we've currently cleared Health Canada Class 2 device approval. And we're also, we rolled out several pilots for medical education to prove that the resolution, readability, and teaching potential is just as good as traditional reading rooms. So here's a video, I think, coming up of what that looks like. So here's a screenshot. One of the headsets is loaded up with this. It is a demo version. It's not the full version. So you will be able to look at some images in it and play around with it after this portion of the talk. But here, for those at home, we're on slide 24, just playing a video of Sievert right now. So the value of this is several fold. So we'll talk a little about this at the very end, but I don't need to tell all of you being masked that we're in the middle of the pandemic. And so if you're in a healthcare field, health sciences field, where you may have traditionally had a lab, where you may have traditionally been able to sit next to your radiologist who would teach you imagery, you've lost access to that in the pandemic. So we have collaboration features that actually allow you to meet in the virtual reading space, either from an educational perspective or to consult another expert. Or my wish, because I work a lot of rural emergency room, is, sometimes I have a fracture and I'm not sure, can I just leave it be or do I need to reduce it? It's nice to be able to meet virtually with the radiologist and say, this is where it's off, or meet with the orthopedic surgeon and say, this is why I don't like the alignment of this fracture. This is how it needs to be reset. And so we kind of alluded to this in previous lectures when we talked about technology for austere environments and for space medicine, but we actually brought Sievert underwater on the Aquanaut mission that I did in 2019. So I think I talked about this a few classes ago, but basically what we did is we ran that same setup just over 4,600 kilometers. So I was underwater 20 feet in the Florida Keys. We set up the radiology reading room. We had a simulated patient, we had a simulated scapular, so shoulder blade fracture from a trauma. And then I was able to meet up with the head of radiology in Saskatoon, 4,600 kilometers away, in that exact same kind of consultation and collaboration type of spirit. So for those of you at home, we're at slide 26, and basically they were able to take me through all the critical findings. And so we're going to get a little bit more into talking about the space medicine in the next part of this talk, but you can imagine, you know, if you're whether you're in the middle of nowhere in a northern ER, or you're you know, in space in a place that's not so far away that you have a considerable time delay, you can actually still consult with Earth in real time for medical expertise. So we've also flown this in 0G. I think I showed you that photo last time, but here's one of my teammates, Heidi, who's actually showing off how this worked in 0G. And we have plans to do some further testing in parabolic flight. Okay, so we talked about 360 video, we talked about radiology in virtual reality. So let's talk about the last virtual reality educational module that we have. And so we talked earlier about needing to retire risk, especially when you're doing invasive things in medicine. And so this is our caregiver platform, and that's essentially what we do. We build virtual reality educational modules for different healthcare bodies. And so we've created airway modules for paramedics and for anesthetists that allows them to practice everything from chin tilts and jaw thrusts to intubation. And this also allows the standardization and assessment. So we also can record these interactions. We can make sure that they're meeting the specific checkpoints, and allows an assessor to review, or allows the student as also to review how they did, what they may have missed, what needs improvement. We've used this for medical lab techs in deep space. And the reason I'm going so quickly through these is so I can spend time for the videos. So we've built a VR medical lab environment this is for the Saskatchewan Society of Medical Lab Techs. This is for slide 32 for those at home. Just let that load in theory. So this is an orientation to the VR lab environment, just like the exact same environment they would see. You see the centrifuge. They're able to interact with the pipette, load it up. In this case, they're learning to drop a urinalysis sample. So once they grab the pipette, they drop their sample. And this is one part that we're all kind of fond of. So once you pipette that sample onto the slide, you can actually look at it through the microscope and interact with it and observe it just like you would with a traditional sample in the lab. And then I just talked about the airway module that we built for the Society of Paramedics. So here's a sample of what that looks like. So here you can see that they're trying to find the appropriate nasopharyngeal airway for their patient. And then just like you would in real life, you would practice your hand hygiene, make sure you're doing that with gloves on, put on lubricant, and then insert it just as you would in real life. This is that jaw thrust, head tilt jaw thrust maneuver I was telling you about. You can also suction. And my favorite part, you can also intubate. So you have the laryngoscope. So this is what I mean by retiring risk. Like, you don't want the first time you do something that's life or death to be in a life or death situation. You want to know the equipment familiarization. You want to know the hand motions. You want to build that muscle memory before you get to the stress of a real life situation. So we're just going to skip past this. Okay. So I also promised you we would talk about how this applies to the space flight environment. So if you remember from the space medicine lecture, space is trying to kill you. That was the one takeaway from that. And so we also talked about the whole laundry list of risks when it comes to longer duration space missions, and it's a very long list. And two that I mentioned specifically were the risk of not adequately interacting with your computer, so inadequate human-computer interaction, and also skills deterioration. And so like we said last time, if you're the crew medical officer and the first time that you learn to put a IV in your patient is on Earth, and then you get to Mars 9 months later and you haven't practiced that skill, well, then your patient's probably going to look like a pincushion. We also talked about, just as a refresher, the packing principles of space. So you're constrained in mass, volume, power. What you have to have with you needs to be easy to use, radiation resistant, and have a long shelf life. And so what we talked about last time is what would be ideal if you could meet all these constraints is to upload all of these skills to your brain, like in the Matrix. VR isn't quite uploading it to your brain like the Matrix, but it still does allow you to maintain your skills base without contravening those packing constraints, right? So you're still able to, you don't have to necessarily bring an entire simulation lab with you. You don't need to bring all that heavy equipment. You can still, but you can still practice those skills in VR. And in fact, VR has been employed as well as augmented reality on the space station. So they've experimented with digital overlays for practicing critical skills. They've used, there's some really neat high quality 360 videos of tours through the International Space Station. So there has been 360 filming. There's been use of VR, AR all on the ISS. So we've also done some work. We've been contracted by the Canadian Space Agency for exactly that, to build up skills modules for astronauts to practice in during long duration missions to the moon and beyond. And so here's a snapshot of a sepsis module that we built for the Canadian Space Agency. Hopefully this will play.
Warning, 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 warning. Suit breach detected. EVA-1.
EVA-1, this is EVA-2. Come in.
Approach waypoint.
Acknowledged. EVA-1, this is EVA-2. Come in.
So in this case, you're on a moonwalk and you've had a suit breach and one of your astronauts is down. And that's where you start off with.
Mike.
And we did our best to recreate the lunar
Retrieve
gravity and the
Stay with me,
lunar
buddy. Looks like you have a suit
illumination
breach.
and shadowing.
I'm on it.
And that is my
Secure
voice you're
patch.
hearing. This was my opportunity to play out my lifelong dream to be an astronaut on the moon. And that's the company's
Return
CEO,
to
who's the other
base.
astronaut
Oh,
there.
that was close, bud. Let's get you back to base to get you checked out.
So this is where the VR begins.
Oh, good. You're up. That was a close one. How do you feel?
And so once you're in the caregiver suite, you're actually able to perform
had
a
a
real
suit
life
breach, but we got you
assessment,
patched up in time.
slap on
I'm just
monitors,
going to give you a once
put
over
in
from head to toe
instruments,
now to make sure you're okay.
to do an assessment as you would in real life.
We're going to start by putting
And so
some
the first
monitors
thing we
on
do
you,
here
make
is I
sure
think
that your
we
O2 sats
apply
have recovered.
monitors.
You got down to 85% out there. Satting at 95%, not bad. Heart rate looks pretty good, 78 beats per minute. Now we're going to do a quick head and neck exam. Just want to see what your pupils are doing. Right eye, 3 millimeters, reactive to light. Left eye, 3 millimeters, reactive to light. Pupils are 3 millimeters and equal and reactive to light. I'm just going to take a look at your tympanic membranes now. With that
And then
kind
one of my
decompression,
favorite
you're at
parts,
risk of a
you
eardrum
can also
injury.
use the otoscope to look at the inner ear of the patient,
Well,
the middle
you
ear.
got off pretty lucky this time. Tympanic membrane is intact, no signs of perforation.
And so that's an example of one of the sepsis, one of the
gonna have a look
scenarios in the
inside
sepsis
your
module. All right,
cells,
so we'll go
look at
back
these
to the main presentation. So slide 44 for those at home. So we are currently building out our virtual reality modules for multiple regulatory bodies. We talked about paramedics, nursing schools, medical lab techs, and our work with the Canadian Space Agency, and then we have plans to do more high fidelity testing and even more space flight environments. So let's bring it back to home, like we did a couple of lectures ago when we talked about space medicine. So we asked a question then about not just meeting the standard of care when it comes to healthcare, but surpassing it. And we're going to ask the same question about education and access to healthcare. And so I really like this slide. This is from our friends at Oculus, and they talk about the quote unquote superpowers of virtual reality. And so we talked about some of these. We talked about building that muscle memory before you ever get to the real life skill. We talked about retiring risks, so handling a scalpel, performing a procedure before you ever get to a real life scenario. You can build collaborative scenarios. You can unlimited redos. So if you accidentally hit an artery in VR, it's not game over. The cost efficiencies, building that confidence and that user retention as well. So this is a slide that we've seen before. So we previously asked, what do all of these austere environments have in common? And then we took it a step further and said, well, what do they have in common with a rural village in Kenya? And then we said, let's look at the global distribution of rural populations on Earth. And that's about 44% as of 2019. So 44% of people live away from a major tertiary care center, from a hospital with all the bells and whistles. And we talked about bringing access to meeting that standard of care in austere environments as well as in space. So the final part of that equation is, what does all of that have in common with something that's really familiar to us in this day and age? And so this is slide 49, a very familiar scene: virtual learning, virtual working, remotely tying in and connecting. And so pandemic life is an example of an austere environment, because our traditional resources, such as learning labs, simulations, interaction with the preceptor, have been taken away. So how do we use technology to build that back? And then where do we go from there? And so the other part of this is that immersive technologies aren't just for space. They're not just for our most remote and resource limited communities on Earth, but they're also for building, bringing back our traditional learning environments, and doing so in a way that meets the standard of education, but also surpassing it, giving us the ability to review our procedures, see where we may have missed things, try reviewing, creating algorithms to look at how we learn and then optimize that learning. So let's take a step back to the macro level, out of the lexonic world, out of the space world, and let's talk about the future of immersive technology in medical education. And so part of this involves bringing in other technologies. So machine learning, AI is a big one. So this is slide 52. So here's another example of pediatric grand rounds. This is from McMaster University, and they talk about using both big data and AI to to optimize both diagnostics as well as patient outcomes. And this is something that's very relevant to the College of Family Physicians of Canada. So they put out an article talking about the future of machine learning for family practice. I think as of yesterday, the U of A has named a AI chair in medicine, as per my email. And coming back to problem solving and maintaining standardization, one very real problem that the College of Family Physicians dealt with over the pandemic is licensing physicians, graduating physicians who are finishing their residency, because typically the family medicine exam is an in-person exam. You do the written person on computer, and then you actually have a kind of OSCE structured clinical exam wherein you interact with a patient, but you can't do that in the pandemic. So then how do we graduate doctors while still keeping that component? And we argue that there's a very real role for immersive technologies to play there. So what does the future hold for immersive technologies in our everyday work? What if we could use it for instruction and troubleshooting, whether we're talking about surgery or interventional radiology, or even fixing a car as a mechanic. What if we could get rid of the amount of physical stuff we use by employing digital overlays in our everyday life? So the bottom line is there's a lot of potential and promise for immersive technologies. And I think we're at the very beginning of the inflection point as it gains more acceptance. We're seeing more and more schools with endowed chairs for extended reality, immersive medicine. We're seeing increased partnerships between commercial entities like HoloLens and industry like ourselves and institutions. So the bottom line is stay tuned for more. So what I hope you take away from this is there's a lot of potential and promise. We need these types of technologies to address medical challenges, whether we're talking about the pandemic, whether we're talking about the Northern Arctic population, whether we're talking about space. And there's more to come. So thank you very much for your attention.